Hello friends, good afternoon, good evening and good morning to you all. Today we will be seeing about an applied aspect of anatomy with respect to orthopedics. I think guys this is a very tough time and you guys are hope reading well and staying healthy. We will move to the session now. So, in this session we will be discussing about few applied aspects of upper limb topics, and to start with, let us see the first question. Brachial plexus injuries are commonly associated with fractures of proximal third clavicle, middle third clavicle, distal third clavicle, or it is related to acromioclavicular joint dislocation. To analyze this question or to answer this question, we need to know about the anatomy of clavicle and the relationship of the different structures around the clavicle. So, we will go to the anatomy of clavicle first. So, when you see the clavicle is an F shaped bone sorry guys, yeah. So, when you look into the clavicle is like an F shaped bone. It has got a curvature like this. So, on the medial side, this is the medial side and this is the lateral of or the lateral side. In the medial side, it is convex anteriorly, and on the lateral side it is concave anteriorly. There are lot of differences between the medial 2/3 of the clavicle and the lateral 1/3 of the clavicle. If I want to say one, the medial 2/3 of the clavicle ossifies from the cartilage. So, it is called as endochondral ossification. Okay. This ossification type is called as endochondral ossification. The lateral 1/3 clavicle ossifies from membrane. So, which is called as membranous ossification. So, the lateral third clavicle ossifies from a membrane. So, which is basically a membranous ossification type. And if you see the medial 2/3 of the clavicle, anatomically it is cylindrical in nature. Whereas the lateral 1/3 of the clavicle is flat in nature. Okay. So, if you see the medial 2/3 of the clavicle, has got a muscle beneath it in the middle third, which is called as a subclavius muscle. Okay. So, in the lateral 1/3 beneath it there is a ligament which is called as coracoclavicular ligament. Okay. So, these are certain differences between the lateral 1/3 of the clavicle and the medial 2/3 of the clavicle. And if you look into the clavicle from an superior view, you will have an image like this. Okay. So, this is a superior view of the clavicle. Okay. So, this is the lateral end of the clavicle and this is the medial end of the clavicle. And when you look into the muscles which are attached to the clavicle, on the lateral side from the anterior aspect, there is a muscle which takes origin here, which is called as a deltoid muscle. So, this is deltoid muscle. The posterior aspect of the lateral 1/3 gives attachment or gives insertion for a muscle called as trapezius muscle. And the medial 2/3 on the anterior side gives attachment or gives origin for a muscle called as pectoralis major muscle. Guys, you all know pectoralis major muscle has got two heads in it. One is the sternocostal head and another one is the clavicular head. So, the clavicular head arises from the medial 2/3 anterior aspect, and from the superior aspect, okay, there is a muscle which gets its origin, which is called as the sternocleidomastoid muscle, nothing but the sternocleidomastoid muscle. Okay. So, this is about the muscles which are taking its origin, as we have already seen on the inferior aspect, in the middle third on the inferior aspect. Okay. So, there is a muscle which gets inserted into the middle third of the clavicle in its middle third. So, that muscle is subclavius muscle, that muscle is subclavius muscle. With the same view, if you look into the clavicle, in the same view from the superior aspect, okay, from the superior aspect if you see. So, this will be the anterior side and this will be the posterior side, this is the medial end of the clavicle and this is the lateral end of the clavicle. Okay. If you look very carefully, just posterior to the medial end of the clavicle, there is one important structure which runs, and this structure which is running just behind the medial end is the subclavian vein. This is subclavian vein. Okay. This is subclavian vein. Just posterior to the subclavian vein, you get a muscle which gets inserted into the first rib, and this muscle is called as the scalenus anterior muscle. This muscle is called as the scalenus anterior muscle. Posterior to the scalenus anterior muscle, you get an important artery running here, which is nothing but the subclavian artery, and posterior to the subclavian artery, you get the bunch of nerves which are running here, which are nothing but the brachial plexus, So, students, so you have to understand this relationship, which is very important. Just posterior to the medial end of the clavicle, okay. So, just posterior to the medial end of the clavicle, you get these three important structures, okay. One is the subclavian vein, then subclavian artery, then the divisions and the parts of brachial plexus here. So, this relationship is important, and to understand the other way of relationship with the clavicle, we will go to the next slide. Here we are going to see the clavicle in an anteroposterior way. So, this is the clavicle, okay. So, this will be the anterior side and this will be the posterior side, okay, and this will be the lateral side and this is the medial side, okay. So, as we already seen the subclavian vein, which is immediately posterior